Well, if someone you loved collapsed and needed CPR, would you know what to do? Gunderson's Health System cardiologist, Dr. Ward Brown, joins us this morning to explain why it's important that we learn the skill and just how easy it is to pick up. Good morning, Dr. Brown. Thanks for getting up with us.
Good morning, Amy.
CPR, a lot of people know how to do CPR, yet a lot of people don't, and a lot of those folks are intimidated. They think that they won't be able to do it, but why would you encourage them to reach out of their comfort zones and learn more about how to perform CPR?
Well, Amy, there's about 300,000 plus sudden cardiac deaths every year, and around 80% of those happen outside of a healthcare facility. They happen mainly at home. So having the courage and the knowledge to do CPR can be life-saving for a family member or a loved one.
And it really is not all that difficult.
No, it definitely is not. And there's many heart saver courses provided by the various health institutions in our community here, sponsored by the American Heart Association. And for a few hours of learning, you can potentially save a life. Some
people intimidated not only because they'd actually be, working on a person, but they're afraid of a lawsuit. But people who administer CPR are protected.
Yes, they are. There's the Good Samaritan Clause in Wisconsin, and you are protected legally from any liability.
How efficient and how successful is CPR?
Well, unfortunately, when a person suffers a sudden cardiac arrest, if CPR is not started right away, death or severe brain damage is highly likely. However, if CPR can be started immediately, you can have resuscitation success up to 70% of the time.
Oh, that's a pretty good statistic. What happens if you don't know CPR, but you're the first person on the scene and you call 911? Are our area dispatchers able to help talk folks through it?
Yes, Amy, they are. And that's something that is somewhat new, where they're able to be talked through for performing CPR and life-saving measures.
Because we just want to get that heart pumping and some oxygen in the system as well. So, Dr. Brown, one more time, is it easy to learn this, and where do people, learn the skill?
Okay. The quick answer is yes, it is. It's very easy to learn. You pump hard, pump fast, and you don't have to worry about doing the mouth-to-mouth. That's not necessary by a lay person. And as far as where can you go, both Gunderson Health System can do it, as well as Franciscan Skemp and the Y, and there's a number of other places that will provide the education as well.
The Red Cross as well. Dr. Brown, thanks so much for getting up with us this morning, and a happy Heart Month to you, and thanks for the advice.
Thank you.
All right. Dustin is up.